And we are continuing the conversation about women prioritizing their health after baby with Dr. Kimberly Newton with the Cone Health Center for Women's Healthcare. Okay, so you always hear women as they are getting ready to deliver that they're in their third trimester, right? But this
Mhm.
particular program concentrates on the fourth trimester. What is the fourth trimester?
Oh, that is such a great question because I do feel like that's a buzzword that a lot of us hear out on social media and various places. The fourth trimester really refers to the 12 weeks after birth because there are a lot of physical, hormonal, and mental changes that happen during that time that are really unique. And there is more and more research and experience showing us that this time is critically important for parents and also critically important for children as well.
Okay, so this all-encompassing care, right? It's physical health, emotional health that you said, mental health. Let's just start with just the physical health. What should women anticipate during this time, and what steps can they take during that time of recovery?
Absolutely. So, a lot of the physical recovery, some of it is the same regardless of how you deliver your baby. So, first of all, you've grown a human in your body. And so, having to kind of readjust to this body that no longer has a baby inside. So, some of that is just gaining back your muscle strength, your center of balance. Additionally, a lot of people don't expect this, but I always love to anticipate this for my new parents is that there's also just that kind of return to normal menstruation and even some bleeding that is just natural after birth of a baby. So getting back to that physical point that you were at even before you became pregnant, it takes time. And I think being gentle with yourself and gracious with yourself along that process, but then also really when something feels abnormal with your body, talking to your doctor about it because we can help understand whether that's normal or also help seek other physical healing modalities that people sometimes need. Sometimes people need
Hmm.
physical therapy after delivering a baby because it is really hard to deliver a baby. And so just really making sure that we are getting people back to that place of physical wellness that they were at before they became pregnant.
And usually that's just put on the back burner because then everything you do is thinking about the baby. All right, what may be some signs and symptoms that we should be aware of that would indicate that maybe you should contact your physician or your advanced practice provider right away?
Absolutely. So, some things that I always want people I'm taking care of to be looking for would be if they are having a headache that is not getting better despite taking Tylenol, but despite drinking water and eating, those would be something that we're really concerned about. Additionally, if you are someone who has been checking your blood pressure while you have been pregnant, and you have a headache, check your blood pressure because there is something called preeclampsia that can come up after delivery. If people are really dizzy, lightheaded, passing out, that is not normal after delivery of a baby, and we want to be seeing those people. Additionally, in terms of the bleeding that we talked about before, it is normal and natural to bleed after delivery. But if someone is soaking through a pad every single hour, that is not normal bleeding, and we would recommend coming to the hospital for that or reaching out to your healthcare provider. And we are really lucky at Cone Health that we have a pregnant and recently pregnant focused ER in the maternity assessment unit. So that is always a safe place to come if people are really concerned about any symptoms that they have.
Which is fantastic because these are things that they don't talk about at the baby shower for sure, right? And these are things that actually do happen. So we're going to continue to talk about what happens in that fourth trimester right after birth. We'll be back right after the break.